Welcome everybody to the first ever webinar for Down Syndrome Connections Las Vegas. And we are so excited today to have Laura Cifra-Bean, who is an MD and also a mom to Chris, who has Down syndrome as well. He's 30. And some of you who were on earlier met him a little bit. She's a medical outreach for DSCLV, which is the Down Syndrome Association of Northeast Ohio. And I met her through the Down Syndrome Collaborative. We're a member of the Down Syndrome Collaborative that meets monthly to talk about new and expectant parents. I'm going to turn it over to Laura.
Oh, thanks. Can everybody see my slides okay? We're here tonight where we'll talk about the pediatric healthcare guidelines from birth to age 12. Just going to show our disclaimer, housekeeping, that this webinar and anything I say or things you learn from our website or our handouts or our volunteers, it's not specific medical or legal advice and doesn't constitute a medical or legal relationship. So we're just offering education and for general purposes. And I can answer general questions about Down syndrome at the end, but I can't give specific advice for a specific child because I'm not your child's doctor or healthcare provider. And this is my son, Chris, as you saw. He's 30 years old. So I found out Chris was going to have Down syndrome when I was a fourth-year medical student. And they thought he was going to have some complications, so I took the next year off. And then I went back to pediatric residency and spent 25 years being a primary care doctor, seeing a lot of patients with Down syndrome and other disabilities, and that was the joy of my career. Chris had some health issues in 2021, which led me to leave clinical practice, and I began my position as Medical Outreach Director at Down Syndrome Association of Northeast Ohio, which I'm so excited and grateful for because I'm getting to do a lot of things to educate parents and students and medical students and genetic counselors, and just really trying to make sure families have the information and healthcare providers have the information to take the best care they can of people in our community, including Chris. Okay. So we're going to go over the American Academy of Pediatrics Health Supervision for Children and Adolescents with Down Syndrome. That these guidelines were first created in 1994. They were revised in 2011 and most recently in the spring of 2022. And they can be found at this link. And I think I have a QR code under there, but I think my screen is blocking it, so I can't see it. I would really advise you to download these and read them and discuss them with your child's healthcare team. So at birth, as you guys all know, the baby gets a thorough evaluation, and the doctor would be looking for medical issues, especially heart problems, gastrointestinal problems, feeding issues, or eye problems such as cataracts or any other thing they can see about the eye. The heart problems that can happen on the typical heart structure is that first figure A. A lot of babies with Down syndrome might have something called an AV canal or an atrioventricular canal defect, where there is a hole in the bottom chamber of a heart, the VSD, a hole in the top chamber of the heart, an ASD, and it's all connected in the middle. So there's a lot of mixing of the blood. So the blood that goes to the body does not necessarily have enough oxygen. Also, there can be isolated atrial septal defects where there's just a hole in the top chambers of the heart, or ventricular septal defects where there's a hole in the bottom chambers of the heart. Some babies, though it's not as common, have something called tetralogy of Fallot, where there again is the ventricular septal defect. There's some thickening of the heart muscle, and there's some problems with the valves and the blood vessels. And then some babies have a patent ductus arteriosus, where the ductus arteriosus is a blood vessel that is open when the baby is inside the mom to send the blood to the placenta, and then has to close after the baby is born, and sometimes that doesn't close. All of these conditions would be followed by a cardiologist, and depending on the severity, may need heart surgery sometimes right away, or sometimes as when the baby gets a little bit older. We also look for any gastrointestinal problems. So we want to make sure the baby can eat and swallow, that there's not vomiting, that the baby is passing stool in the appropriate time. One thing that babies with Down syndrome can have is something called duodenal atresia, and that's where the end of the stomach is not actually connected to the small intestines, and then the food doesn't go through, it has to come back up. Or Hirschsprung's disease, and that's where there's not the normal nerve cells in the intestines, and then the stool cannot get out, and there's blockages, and that also would show up with vomiting and problems with not being able to stool. So there's certain testing at birth that we recommend if a baby is known to have Down syndrome prenatally or is thought to have Down syndrome because of physical exam findings at birth. And that includes blood work, such as the karyotype to show the chromosomes, a complete blood count, a state metabolic screen, which is also known as the PKU test, that checks for thyroid function, which is very important. In Ohio, that checks checks for 2 different tests of thyroid function. So that's all that the doctor needs to order. In some states, it's not as comprehensive, and then you would need to order some additional thyroid blood work at birth. Other tests include an echocardiogram, which should be for all babies who have Down syndrome, whether or not they have a heart murmur or something that you can detect on exams, because some of the big heart defects don't even have a heart murmur, and we only pick it up on echocardiogram. Hearing screen, hearing loss can happen in babies with Down syndrome, so there's universal hearing screening for all babies, but especially important for babies with Down syndrome. And a car seat challenge to make sure that the baby can breathe and keep its oxygen level up, the neck doesn't flop over or the head doesn't flop over while the baby's in the car seat. The CBC we get, the complete blood count, is for something called transient myeloproliferative disorder. And that's when there's an increased number of immature white blood cells. This usually goes away by itself, but it does put the baby at risk for leukemia in the first 4 years of life. So the baby would need to be evaluated and followed by a hematologist, a blood specialist, to make sure that no complications are going to occur. So from birth to 1 month, one of the most important things we do is follow the feeding and the weight gain. Many babies with Down syndrome are able to breastfeed, but lactation consultation can be very helpful. All the links here are on the DSCLV website, and for the things I thought you might want more commonly, I did put in QR codes also, so you can just use your camera to scan it and then go to the website. Many people who breastfeed babies with Down syndrome do need to supplement, not everybody, and also babies with congenital heart disease, we keep an extra eye on their feeding. Sometimes there needs to be different higher calorie formula or changes to the feeding regimen made so that the baby gains weight adequately. Also, in the first year of life, want to make sure that the baby is hooked up with early intervention through the state. I put the link, I'm sure you guys are hooked up already, but for the Ohio and the Nevada group. And then just as with all babies, we want to make sure the babies are sleeping safely to avoid SIDS. So the baby should be alone on its back in the crib with a good fitting mattress. From 1 month to 1 year, this is how the guidelines are broken down into age groups and what the doctor should be asking you and what the doctor should be looking for on physical exam. Again, the doctor will pay a lot of attention to feeding and weight gain, and there are specific growth curves for Down syndrome available at the CDC. And when the children with Down syndrome are small, that's more important to follow on a specific growth curve for babies with Down syndrome, because the weight gain can be a little more slow. Hearing is retested at 6 months, even if the newborn hearing test was normal. If the newborn hearing test was not normal, then that's usually repeated sooner, like at a month or so. Repeat thyroid testing is done at 6 months and 1 year. thyroid hormone is very important in all children for normal growth and development. And there are some babies whose thyroid tests are normal at birth, and then by the time they're 6 months old, they are abnormal. So it's what if the thyroid test is abnormal, it is important to start treatment as soon as possible. So it's the 6-month test is really important. Usually the thyroid abnormalities are hypothyroidism, like low thyroid, and that's treated very easily with usually a once a day pill. Occasionally there are people with Down syndrome who get hyperthyroidism, and that's a little more tricky to treat. But pediatric endocrine doctors see babies and children and adults with Down syndrome all the time. So you can get very good treatment for it. All babies with Down syndrome should see an eye doctor by 6 months of age to make sure the eyes are lining up fine, that there's no cataracts, that everything looks good. Yearly, we do a blood count and a test for iron deficiency, and then the vaccines are per the usual schedule. Keeping in mind that some babies might qualify for RSV prevention. RSV is that bad respiratory syncytial virus. I'm sure you've all been hearing about this. Has been a terrible RSV season. And babies with Down syndrome are at increased risk for severe RSV, including the need to be hospitalized, be put in the intensive care unit, be put on a ventilator, and even die. So it's very important in the what we call the sick season, to try to keep the babies away from people with coughs and colds as much as you can. I know it's hard if you have other children in your house. That's a really hard thing. You just do your best. Currently, babies who are born prematurely or who have heart defects may qualify for a monthly RSV prevention shot called Synagis. It's very expensive, so your doctor has to get you approved for that. There are some new RSV prevention modalities that are being under FDA evaluation right now and might be available by next fall. So that could be very exciting. I see there's 4 things in the chat. I'm just going to look quickly to make sure I'm not missing a question. Thank you. Great, putting the links in the chat. Great, thank you so much. I'm going to go through some common concerns throughout childhood to explain what they are, and then I'll go through, again, the yearly age to age type of things your pediatrician or healthcare provider would be telling you about or screening for. Obstructive sleep apnea is very common in people with Down syndrome. So that could present as snoring, pausing and breathing, restless sleep, sleeping in a funny position, seeming to be tired during the daytime. In older kids, it could be some behavior problems. So that's something we always keep in mind in people with Down syndrome. Overweight or obesity gets very common starting in toddlerhood and beyond. So important to keep an eye on that. Blood abnormalities such as leukemia can occur. Atlantoaxial instability is a neck problem that can occur in people with Down syndrome. Up to about 14% of people can have it asymptomatically, and about 1% might have symptoms from it. But I want to explain what it is because it's a little confusing. So this picture is your cervical vertebrae in your neck, and your atlas is the first vertebrae, and your axis is the second vertebrae. And in a spine that does not have atlantoaxial instability, when you move your head or neck, everything stays lined up and where it should be. In a spine where there is atlantoaxial instability, there's movement of that top vertebrae, the atlas, and then that can press on the spinal cord and cause symptoms. So every year, your doctor should talk to you about signs and symptoms, and I will go through that now. The American Academy of Pediatrics recommends that you contact your physician immediately for an X-ray in the neutral position, which means just the head straight and the neck straight, not bent down and not bent backwards. If there's a change in how your child walks, uses their arms or hands, change in bowel or bladder control for an older child, of course, if they have a head tilt that stays like that, if they complain of neck pain, if there's a new onset of weakness, or you notice a decrease in activity level or function. If that X-ray is abnormal or the concerns persist, then you would want to see a pediatric neurosurgeon or a pediatric orthopedic surgeon. It depends regionally who handles atlantoaxial instability. And then precautions that the American Academy of Pediatric recommends for all children with Down syndrome, since you can have this and not have any symptoms of it, is that to avoid excessive flexion or extension of the neck. So you don't want to bend it way down and you don't want to bend it way back during any anesthesia, surgical, or X-ray procedure to minimize the risk of spinal cord injury. Also avoiding trampolines unless it's part of a training program with appropriate supervision and safety measures. And just to be aware that participation in contact sports such as football, soccer, and gymnastics does place children at risk for spinal cord injuries. Okay, moving on to some other common concerns. Autism, there are children with Down syndrome who have co-occurring autism and Down syndrome. It usually presents a little differently than people who do not have Down syndrome. That's the social skills are better. So sometimes it is a little more difficult to make that diagnosis of autism in a person with Down syndrome, because is it just a speech delay? It really comes to the social interaction part, and it would take a specialist to diagnose that. Attention deficit disorder, behavior concerns are very common. Regression, which is usually in late teenagers and adults with Down syndrome, that can happen with some acute changes in functioning. And then being aware of the risk for abuse in people with disabilities in general and Down syndrome. Autoimmune diseases are also more common in people with Down syndrome, such as celiac disease, which is gastrointestinal disease with gluten sensitivity, which can present with abdominal pain, vomiting, diarrhea, poor weight gain, or behavior changes, or be asymptomatic. Thyroid disease, type 1 diabetes, alopecia or big areas of hair loss, and a specific type of arthritis that's seen in people with Down syndrome. Skin conditions are very common in people with Down syndrome. Dry skin, a lot of babies get those really red, chapped cheeks, pimples, boils, things like that. Moya disease, it's not very frequent in people with Down syndrome, but it does occur, and it is a disorder of the blood vessels in the brain that can present with stroke-like symptoms, and it can be in childhood. So it's not that people with Down syndrome frequently have Moya, but if you find people who have Moya, more of them have Down syndrome. So it's just something to be aware of, and a lot of doctors aren't aware of it. So if your child is doing something funny, like that reminds you of an adult with a stroke, or then that's definitely something you would want to bring to your pediatrician's attention or go to the emergency room immediately. Dental care, very important with people with Down syndrome. A lot of adults with Down syndrome have a lot of gum disease, and so you want to start early with good dental care. And also for the babies who have the congenital heart disease, always the dental care is very important. Infectious diseases, especially pneumonia and respiratory viruses, as we talked about before, RSV, but also influenza. COVID in the adults was seen to be much worse in adults over 40 who had Down syndrome, but there is good evidence that people with Down syndrome do respond to the COVID vaccines. So now the adults are not getting as sick, so that's very good. So now we'll go from age to age, discussing what your pediatrician or healthcare provider will probably bring up. Monitoring development every visit, making sure you're getting the right therapies if you have any questions, and screening for autism at 18 to 24 months. This is a link from Kennedy Krieger that explains a little more about how the combination of Down syndrome and autism might present in a patient. As I said, beginning dental care, beginning brushing teeth, dental care, seeing the dentist, very important. A sleep study to rule out obstructive sleep apnea is always done at age 3 to 4 years, even if there's no sign of disordered breathing, just because it's so common in people with Down syndrome. Every checkup, we monitor the growth and assess for feeding issues. And again, yearly blood work to monitor the blood count, look for iron deficiency, and make sure the thyroid function is okay. Yearly vision and hearing screening, and the doctor should review the signs of atlantoaxial instability and perform a physical exam to make sure there's no signs of abnormalities. And the vaccines, again, are per usual schedule. Procedures can get more difficult at this age, so like getting the thyroids drawn, getting the sleep study done. There's this site, Charlie's Clinic, has very good social stories that you can read to your child as they get preschool age 3, 4, 5 to get them more ready for some procedures they might need to do. And social stories can work all the way through adulthood and to prepare your person for what might happen. This is also a good time to start talking about body parts when you're starting to do potty training, maybe at 3, 4, 5. Very young, you want to start talking about, that they're the boss of their bodies, that, only mommy or daddy or the doctor or can touch certain parts when they're helping get you cleaned up and what's appropriate touch. Start to emphasize as they get a little older, maybe towards 5, privacy and things like that, just to really start the safety training, not to make it scary, but to start the safety training, even when they're that young. And then this is a very good handout on potty training. And I know DSCLV, we every once in a while have webinars on potty training. So there's a lot of resources out there for people with Down syndrome. I'm going to peek in the chat. Yes, potty training it's tricky, and typical kids who don't have Down syndrome, usually 3, 4, I would say people with Down syndrome, 3 is a bit on the early side. It's not bad to try, but most people with Down syndrome are not fully potty trained by age 3, and it can take longer. Dr. Patel's presentation is very good. Let me see if there's another question in the chat. Okay, 4, yes. Happy birthday, Millie. Yes, potty training can take a while, but most people get there. It'll get there. You just have to keep doing it. And for everybody, I would say the less you can use pull-ups, the better, because the pull-ups, the kids are just way too comfortable in pull-ups. So there's a lot of, see Dr. Patel's, and then there is a lot of information out there if you need help. At 3 years old, the responsibility for services and education transitions from early intervention to the school district. So the child moves from an IFSP to an IEP. And then 5 through 12 years, again, we're monitoring that weight. And this is when it might start to climb. So this is when it's important to try to keep a handle on things. Starting at 10 years old, we look at the BMI on the chart, not specifically for people with Down syndrome to start gauging the weight status, because many teens and adults with Down syndrome are overweight or obese, and it does put them at risk for sleep apnea. Sleep apnea is a big one, type 2 diabetes, and joint problems. And a healthy diet and regular exercise are real important. And I know everybody with Christopher would like to give him extra cookies and extra this and extra that, and you sometimes feel like you're the mean person, but people with Down syndrome only need about 60% of the calories of a typical person. And it's very hard for people with Down syndrome to lose weight. So the more you prevent the weight gain when they're little, the easier it's going to be. Looking at these growth curves, at around age 10 years, the 50th percentile for Down syndrome hits the 85th percentile on the typical curve, and that's when we start to call people overweight. So by 10 years old, the average person with Down syndrome is overweight. So we want to start using the BMI plots on the typical growth curves, because we don't want our people with Down syndrome to be overweight. It really, for sleep apnea and a lot of things, it's hard. Oops, sorry. We want to monitor development and behavior, encourage increasing ability in the bathroom, so taking their own showers, be able to clean up after themselves, start helping brushing their teeth. Flossing is hard. I have to say, I still help Chris floss his teeth because that's just, we've been trying for a long time, and he can brush his teeth, he does his mouthwash, he does his shower, he shaves, but flossing the teeth is hard. So there's always going to be some things that each child, different things for each child, but that they need help with. But flossing is very important to prevent gum disease, because gum disease can lead to losing the teeth, and that's what we don't want. We want good teeth. You know that. Okay, check the chat. Flossers, yes, we do use flossers. I do agree that flossers are, because it's hard for me to floss his teeth with just regular floss. So I do use the flossers, and he can get like the front teeth, but the back teeth are still. So in these years, as they get older, you're just starting to discuss the transition to middle school. Very important is watching when your children are on the internet and when they want to start using social media, because again, the content that one can get into on the internet is a wide range of appropriateness or not appropriateness, and people with Down syndrome are very visual learners and have very visual memories. So once they see things, then it's very hard to unsee them. And a lot of people with Down syndrome do what we call self-talk, which they're not hallucinating. They totally know what they're doing, but they talk to themselves. And my Chris does it all the time. And they tend to play act things, role play things, and have a very active imagination. So it's important to monitor their content so they're not playing out things in school that might not be appropriate, or people might misconstrue because they don't know the context. And then social media, again, our teenagers and adults are at risk for people taking advantage of them online. So monitoring social media, make sure they're not getting bullied, make sure they're not making friends with strangers and things like that online. The timing of puberty is not delayed, so it's going to happen at about the same time that it would happen for anybody. 10, 11, 12, 13, right in there. So it's important to start discussing puberty so they know what the body changes are. Terry Cowenhoven is a sexuality educator, and she works at the University of Wisconsin. She runs their Down syndrome clinic. I think she's their manager, and she has an adult daughter with Down syndrome, and she is like the expert on puberty and sexuality in people with Down syndrome. And she's written extensively, including these 2 books. She's done very good podcasts. Dr. Kishore Valodi at Children's Hospital of Pittsburgh, he runs the Down syndrome clinic there, and he does a series of podcasts that's available on Apple Podcasts or on his website. And if you look at the QR code, it will take you there. And Terry Cowenhoven has done 2 podcasts that you can listen to also. She also speaks at most of the major conventions. She has a website, she has books. She's just wonderful. I just did one of her webinars a couple months ago, and it was really good. For period management, Advocate General is an adult Down syndrome clinic, one of the biggest adult Down syndrome clinics in the country, which Lisa said, Dr. Jacoin, who was one of your keynotes last year, he runs it, and they have a lot of resources on period management on their website, and this QR code will take you there. One of their resources is a social story about exactly how to change your pad. And as I said, people with Down syndrome are very visual, so a lot of these stories can be very helpful, and a lot of people have things all around their house reminding their person with Down syndrome what to do. So that's very common. And again, yearly, we're going to assess hearing and vision. We're going to do the blood count, iron studies, and the thyroid studies, and we're going to do the vaccines. as the usual schedule. These are 2 more forms of the resources from the American Academy of Pediatrics. The top one is a 1-page handout that goes through the whole age of the child, that at just a simple checklist at every age, what are you supposed to do? And then the bottom one, which is available in English and Spanish, is a more detailed PDF that is family friendly, but goes through what should be done at every checkup. And that is also good to take with you to make sure and your healthcare provider knows what should be done for your child at each visit. That is the end of my prepared content. So I will stop sharing my screen now.